think it's gentlelady in regard to mosquitoes. The Aegis aegypti modified mosquito by Oxitec, which I think is a great control. Not your jurisdiction, but NIH and FDA are working on that. Dr. Burgess, I look forward to hearing your 5 minutes of questioning.
Thank you, Chairman. I don't share your optimism about the FDA and the Oxitec mosquito, but that's a separate discussion. Director Cohen, thank you for being here today. Obviously, your first time before this committee in your role as CDC director, but it's not your first time before this committee, your role as CMS in previous Congresses. Thanks for talking with us at the Doctors Caucus. We all share the goal of rebuilding the faith and trust in the CDC. I think most of us recognize we need a well-functioning and respected CDC in order to protect the American people. You've shared some of your vision with us about how we travel that road, but one thing missing is to the degree that there's been self-reflection and decisions made as far as governance and how things work internally at the CDC. Are you free to speak on that?
About the internal work of the CDC, absolutely.
Well, and what you've done internally to modify the culture, improve the culture.
Yes, so this was work, I want to give credit, that started before I came on board as CDC director. They definitely have changed the structure of the agency to make sure it is more operationally focused, so it is more ready to respond. We've created programs like the CDC Ready program where we are training and keeping warm, ready responders who are trained and ready to be deployed if we would see any emergency. But I think now we are really focusing on is making sure that we can turn data into action quickly and making sure that we're working as one team. At CDC, there is a lot of fantastic experts, but often siloed in their disease states.
Sure. Well, let me just ask you, because we are working on the reauthorization of the Pandemic All Hazard Preparedness Act, have you done an after-action report strictly vis-a-vis the CDC? What happened, what went right, what needed improvement that you could share with us? I've asked Dr. Califf the same question. He's promised to do so, but it's not produced. Do you have such a document?
Yes, so before my tenure, there was an extensive review on how CDC should be reorganized. That was put together as part of what was labeled as the Moving Forward plan, so we'd be happy to share with your team more details on that.
But just as far as the details of what could we have done better? Do we have access to that?
Well, I think there's been many ways in which we've been thinking about lessons learned, particularly whether we think about the communication space or the lab safety space and quality space. Those are all lessons learned we're already baking into our work, and I hope you're already seeing us communicate differently, both more timely, telling folks what we know when we know it, and also what we don't know. I heard that in some opening statements. So I think we are both communicating differently. I think we have many new procedures related to lab quality to make sure we don't ever see the mistakes on the lab side that we saw before. And we are making sure our workforce is ready to respond. But I will say there are still ways in which we need to continue to work with Congress to make sure CDC is funded to be that national security asset that we need for this country. So there are resources and authorities, again, that we look forward to working with you on.
Well, that always sounds odd coming from a political figure arguing that someone should express humility when talking about something that they're really not sure what's going to happen next. We know it's important, we know it's dangerous, but we don't always know what's going to happen next, or we changed our minds with new data that came in, and that's what was really missing at the helm of the CDC during the height of the pandemic. Again, it seems odd for members of Congress to be lecturing people about humility because it's a quality that we're not known for. Just also on the Prestige Biotech that the chairman asked about, have we developed lessons learned in how to prevent this from happening? Or is there going to be an effort created for surveillance of outside labs?
So look, we know we are in unprecedented times with more health threats, and whether those threats come from a lab, from an animal, from a weapon, we need to be ready. And that is exactly why CDC needs to be well-resourced and funded to make sure we are detecting those threats and that we are ready to deploy and respond.
Yeah, but it's not the first time this has happened. We had this same hearing with Dr. Frieden many, many years ago. So it is something that requires some scrutiny. Let me just ask you, I've got the life expectancy increases produced by the Center for Disease Control. It talks about the increases in life expectancy would have been greater if not for the offsetting increases in mortality due to influenza and pneumonia, perinatal conditions. Can you expound upon the perinatal conditions that have contributed to that?
You know, sir, I don't know that I could, but I'd be happy for our team to.
If you will
follow
share
up.
that with us, that's important to me, and I'd like to see the follow-up on that.
Absolutely, will do.
Thank you, Mr. Chairman.
Thank you, gentlemen, for yielding back, and now recognize the gentlelady from Colorado, Ms. DeGette, for her 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you for holding this hearing. Most members of this committee know every year about this time, I always say we should have a hearing on flu preparedness, but like everything else in our lives, now it's become much more complex because now we have three things we're trying to prepare for. So, Dr. Cohen, we're happy to have you where you are because we know you're taking this seriously. Back in February, we had a hearing in this subcommittee with some health officials from CDC, NIH, and FDA about the government's COVID-19 response, which, as you heard today, we keep talking about over and over again, but which we really need to move forward to try to be prepared to respond better the next time instead of just whining about it. At that hearing, your predecessor, Dr. Walensky, urged this committee to provide CDC with new statutory authorities so that it could fulfill its public mission. And some of those priorities were priorities you discussed in your testimony today. You need to turn off your mic. Thanks. So some of these priorities are ones that you provided in your testimony today, and we were talking about it 9 months ago. So I'm kind of disappointed that we haven't made more progress as a Congress in giving CDC more data authorities, because that's what we really need to be able to identify the issue and then to alert the public. So you can't respond to a crisis if you can't measure that crisis or if you're seeing it in the rearview mirror. And CDC doesn't have the authority to do that without Congress. So, there's this effort to transform the agency that started again with your predecessor, CDC, moving forward. And I know you're trying to move this forward and modernize the data and communication infrastructure. Can you give us an update as to your efforts and let us know what you still need so we can work in a bipartisan way to give it to you?
Thank you, Representative DeGette. Yes, our data infrastructure is critical to making sure that CDC is the national security asset that we need. And a lot of work has been done. And I think there's a lot of success stories. At the beginning of the pandemic, we transmit information, electronically, and only about 200 hospitals were able to transmit that data electronically to that. Now we're close to 30,000, right? So we are making significant progress. As a state official from North Carolina, that data was incredibly important to us, and again, wanted both that information to be at the state level and the national level, because I know that our borders were really important. I needed to know what was happening in South Carolina because Charlotte is right on the border there, right? So having information and visibility across borders is really important, and so we need to make sure that we have a national picture of what is going on, and that is the importance of these data authorities. And we're working closely with our states to do what we can and make sure that we can put all the authorities in place. But having that infrastructure and the authorities, and importantly, the resources are.
What authorities do you need us to give you still?
Well, I want to touch on resources, because I will say in our current budget and the way it looks in the House, they zeroed out investments in data infrastructure. That is just not going to to be compatible with a successful CDC. But there's also authorities that allow for us to collect data in a way from both our healthcare partners and our state and local partners in a way that allows us to have that visibility. So we are also happy to work with your teams on how to structure that. We're always talking about data in this case that is de-identified. We're very focused on making sure we're protecting privacy as we make sure to collect this data, but it is really important.
So if you and your team can get back to us specifically with the legislative language. First of all, I agree with you about the resources. If we're going to sit here and collectively say we need to do a better job if there's a new pandemic, we can't zero out your budget for data collection. That's insane, and I don't think that'll happen in the end. But in terms of the legal authorities that you need, if your team can work with us on specific legislative language, then we will try to work in a bipartisan way to make that happen, and I yield back.
Thank you.
Thank the gentlelady for yielding back, and now recognize Mr. Guthrie for his 5 minutes of questions.
Thanks, Dr. Cohen, for being here, and thanks for hosting me in Atlanta and getting to meet your good team. And I will tell you, there are a lot of hardworking Americans in your building trying to make sure we're protected and safe, and we appreciate that. I enjoyed my time there. And as you know, as we discussed, and it gets to, I wouldn't say that I'm whining about COVID. I'm my good friend from Colorado. She is my dear friend. We're not, but we have lessons learned. We lost some faith in a lot of institutions. I'm going to talk about WHO and some others, and I believe you're working to try to do that. And I think we have to work together to try to do that. But just instances that happen, and there's one. It's one of the letters that we had sent to you from the leadership of ENC about the COVID tracker data. I think there were 72,000 deaths that were removed from the CDC COVID tracker website. I think you said it was not you personally, but it was a glitch. There was also CDC's National Vital Statistics System showed less COVID-19 deaths in kids than was previously reported. And so would you explain, I know those are two separate situations, explain those and then what you have done? Because what your group showed me what they want to do with the data. And I believe the people sitting in that room were wanting to use it to give good information for them to protect the American people. The question we have, and we talked about it and other things, is how can we ensure data is being made private? And when you see some of these mistakes and lack of transparency, it's hard to make that case, and I think you want to make it. And so would you talk about those specific instances and then what you've done to fix them?
Yes, well, thank you, Representative Guthrie, and I really appreciated the visit down. Making sure that we have timely and accurate information is critically important. And this, I think, when we look at our mortality data or our death data, this is a success story over the course of the pandemic. At the beginning of the pandemic, the way we were able to report death data was quarterly. It wasn't quick. It wasn't in real time. But we know the pandemic was moving so quickly that we had to report more quickly. And so we used a different mechanism to report death data through case surveillance data. It was essentially the state and local folks were collecting that data and would give it to the CDC. We caveated at the time to say this is preliminary. The gold standard, which was not as timely at the time, we were still reporting, but again, it was slower. We made a lot of improvements. Again, thank you to Congress for those resources, where now we can almost get real time in that gold standard data. And that is what we are using. And we were able to sunset those case surveillance data that you were referring to. So we are now in a better place related to our timeliness and accuracy of the mortality. And look, we're still looking at 1.1 million adults that have lost their lives. So there's 1,700 kids that have lost their lives to COVID. So we do have to use all the tools at our disposal to make sure we're protecting folks.
Okay, thanks. And you talked earlier about I was going to ask you about what's going on in China now, and your assessment from what you know is that it's not a novel virus.
Correct. Not a novel virus. Again, we have been in close touch with our counterparts in China, and that information has been corroborated with other counterparts across the U.S. government, but also with our European Union partners as well. So we feel confident that information has been corroborated.
Because one of the institutions that I feel really failed was the World Health Organization. They seemed to defend, this is my assessment of it, defensive of China when this COVID broke out, when they were doing the indefensible, not sharing information so the rest of the world could react to it. And they have requested specific data from China for this current outbreak, and specifically recent trends in circulation of known pathogens and so forth. Is China responding to the World Health Organization? I know you have people in China that are dealing with their Chinese colleagues. Do you think the World Health Organization is responding in a way that it should? And do you think China is working with them to forward, from what you can corroborate?
Yeah, I don't know firsthand about the WHO and China interactions. Our information is direct from our teams who are in our China office with our counterparts. But my understanding from WHO is that China has been sharing information related to this, and so again, another way to corroborate.
Okay, thanks. You know, also the World Health Organization asked China for information December of 2022. So I guess just to summarize, I'm about out of time. I know we have our own personnel in China for the CDC, and you feel confident that China's being transparent with them as for the information that you have?
Well, I think, scientific diplomacy is incredibly important in that part of the world. We do have a small office, and we are trying to work on things that are mutually agreeable. But I'm sure we would love to do more work, and I'd be happy to talk more about it.
If it was coming straight from scientists, you're probably different than, I know they have to work through their government as well. But thank you for your work and appreciate, I yield back.
Gentleman yields back. Now recognize the ranking member of the full committee, Mr. Pallone, for his 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Cohen, thank you again for being here to talk to us about the CDC's important work, particularly at this time of year when respiratory illnesses are on the top of everyone's mind. As people are scheduling vaccines to ward against seasonal respiratory illnesses of flu, COVID-19, RSV, for themselves and their families. I wanted to know what CDC is seeing in its data about rates of infections, hospitalizations, and deaths. So is CDC seeing a sharper rise in rates of infection or hospitalizations for one of these viruses compared to the others? And what does CDC project through winter in terms of cases, if you will?
Yes. Well, thank you, Representative Pallone. So for the first time this season, you can actually see a consolidated view of COVID, flu, and RSV together on our website now, so you can see the relative impact. I would say that we are in full swing of RSV season. We're seeing a lot of RSV, particularly in the southern part of the country. So we're near peak, is what I would say for RSV. With that, we are also at the beginning of flu season. So we're not having an early flu. We're actually having a pretty, what I would say, typical flu season. We do expect to see a lot more flu cases over the course of December and January. So please do make sure that you're getting your updated flu shot and check what's happening in your communities. But that being said, even though those are both going up and we're at the peak of RSV, COVID is still the respiratory virus that is putting the most number of folks in the hospital and taking their lives. So it's about 15,000 people in the hospital for COVID and about 1,000 people dying per week across the country related to COVID. We are seeing an uptick in COVID. Remember, we had a late summer wave of COVID. We came down from that. We are going back up again, which we expect, again, after a lot of travel and gathering at Thanksgiving. But to remind folks, never too late to get that updated COVID vaccine, and as well as making sure that we're getting access to testing and treatment. Really important, because we have treatment for these diseases, to get tested. You know what you have. That treatment, in addition, could save your life.
Now, what about the monitoring of vaccine uptakes across the country for the three, for flu, COVID-19, RSV? What trends are you seeing about the vaccine or uptake?
Yeah, so now that we are outside the official public health emergency, this is one of the issues we were discussing related to lack of visibility with our data. So we don't have the same level of data visibility that we had when the federal government was purchasing and distributing all the vaccines. What we have now is an imperfect tool to know how folks are or aren't getting vaccinated. We use a survey. It's a survey we've used for decades, so it's a validated survey, but we essentially ask folks, did you get an updated COVID vaccine? And from that survey data, we see about 16% of Americans have gotten the updated COVID vaccine, and that's not enough. I'll say that right now. I've been doing as much as I possibly can to be going around the country, again, meeting with folks, answering questions, campaigns explaining the importance of vaccination, but it's not enough. And I look forward to continuing to work with Congress and other partners to make sure that we can help folks know what tools are out there and have them use them to protect themselves.
Well, that gets into the communications issues. So I had two questions about that, and then we'll probably be out of time. What kind of strategies is CDC employing to facilitate communications of your recommendations to the public and to healthcare workers? And how would a modernized data infrastructure or increased authorities to access more timely health data enhance your ability to make public communication more effective?
So first, we are really concentrating our communications efforts with healthcare providers. We know doctors and nurses are some of the most trusted and most important folks who can talk to people about their vaccinations. One of the top reasons people don't get vaccinated is because their doctor or their nurse practitioner just didn't bring it up. So we're really focusing our effort in a time where there are limited funds on making sure that our healthcare providers have all the information they need. As I said, I am going around the country to answer questions. We're working through trusted providers, but we have more work to do. And yes, would real-time data help us to direct our resources? Absolutely. I'll just say, as when I led through the COVID crisis in North Carolina, we used data day to day to decide, should we deploy teams here? Should we increase media in a certain part of the state because we're seeing lower things? So that real-time data is really important to allow us to make sure that we're tailoring our operational work.
Well, thank you so much. Thank you, Mr.